Welcome to Mindfully Integrative Podcast with your host, Dr. Damaris G. Mindfully Integrative is a podcast discussing ways toward mindfully incorporating integrative health into our lives. This podcast will have informative resources, fun topics, interviews, and discussions relatable for today with a true mindful perspective in a mind-body, holistic life approach.
Hi, how are you? This is Dr. Damaris Maria Grossman, and this is the Mindfully Integrative Show. And today we have an amazing mindful chat with Dr. Andrew Neville. He is a naturopathic doctor, an expert, and 20 years devoting to his patients and also the adrenal fatigue and chronic fatigue syndrome. So I really can't wait for you guys to chat with him and on his perspective and how he's helped heal and give his patients what they need and maybe help one of you that is listening.
Thank you. Appreciate it.
Yeah. So thanks for being on the show. And I always kind of say a little fun facts somebody may not know about you.
Fun fact. So I have a thing for rhinos. My favorite.
I didn't even know.
My
There's
favorite.
Like, what do you mean? What kind of thing? What does that mean?
My favorite animal is a rhinoceros, and I read a book. This is decades ago about rhinoceros, and the symbolism in it is what I liked. Right, rhinos are pretty docile most of the time, kind of stay to themselves for the most part, but they've got this kind of 2-inch thick skin. Right, you ever see like birds standing up like? And as a naturopathic doctor treating adrenal fatigue, which is a condition that's kind of questioned in conventional medicine, you kind of need that 2-inch thick skin actually. And they're pretty just kind of stay to themselves, but they've got this horn just in case somebody gets in their way. So I've got rhinos here and there actually in and around my office.
Oh, that's cool. Yeah, I like elephants. Those are mine. Elephants and turtles. Those are mine.
Yeah, I love it. No, great symbol of elephants as well. Yeah,
those are my top two usually. So yeah, let's get to it. So what? I know. So one, you're a naturopathic doctor. So those that haven't been listening to my show, what is a naturopathic doctor? Most people should know by now because I've had a few of you guys on. You're doctors. So, where your specialty is, and then explain what your specialty is.
Yeah, sure thing. So naturopathic doctors, there are naturopathic medical schools, right, which is specific where it's a 4-year degree, very similar to conventional doctors, where we learn all the didactic stuff, the science, and your pharmacology, biology, all those basic things, and then you go beyond that into clinical practice as well. So it's a 4-year degree. We're trained. I went to school out in Washington at Bastyr University, where we are trained and licensed as basically like GPs, prescriptive rights and things like that. I practice in Pennsylvania, so I practice a little differently out here than I would, but I kind of see us as a bit of a bridge between kind of more alternative medicines, right, and conventional medicine over here.
You're my integrative bridge.
You kind of know a bunch of
I would say.
Yeah, absolutely.
Yeah, I work a lot with NDs recently more, and definitely integrative bridge because we need to have that conversation more instead of like a competition. It's like there's no.
Oh, indeed.
I'm the NP, but I've noticed in my field I've had to really bridge a lot. I'm like, no, there's more out there. There's more info. So, that's why I started this podcast out of passion, trying to integrate as much as possible.
Yeah, it all has its place for sure, right? And the one thing that drew me to naturopathic philosophy, because I didn't grow up, hugging trees or anything. I grew up kind of with a pretty standard upbringing, kind of mired in the one drug for one disease kind of a model, right? And it was when I started having problems with what turned out to be adrenal fatigue, where I was looking for answers, right? And I can be pretty persistent in trying to find answers, and that drew me towards kind of away from conventional medicine and towards more alternative medicine, whether it's chiropractic. And it was a chiropractor actually who mentioned naturopathic medicine, which I had never heard of before. And once I looked at the philosophy of naturopathic medicine, which is about finding and treating the cause, utilizing the healing power of nature, reestablishing kind of the basis for health, right? Not just kind of the treatment of disease, but for health. Once I learned about that philosophy, I mean, my kind of path was chosen for me. And So I ended up going out to Washington to do my naturopathic medical training. It was out there actually that I discovered what was going on. I discovered my predecessor's book about adrenal fatigue.
Okay.
I had some symptoms that were problematic, and I had mixed results, and I had plenty of practitioners trying to treat, whether it was my high blood pressure with meds, or my anxiety, or my gut problems, or my Epstein-Barr that would reactivate, and people would chase after those things, which actually kind of continued in naturopathic medical school. They were brilliant doctors and very good, but they were kind of dancing around kind of what I have learned to be the underlying cause, right? And once I found this book, which was changed, the original version of this is called The Adrenal Syndrome, and he wrote that book back in the 70s. He changed the name to Chronic Fatigue Unmasked 2000, and back in 2000, because adrenal fatigue, if you take that to the nth degree, it can turn into a diagnosable condition, right? Chronic fatigue syndrome. Once I opened that book and read that book, I mean, he described kind of everything that had been going on for me, and it kind of put all these pieces of the puzzle together. Why the anxiety, why the Epstein-Barr, why the gut problems, why the food allergies, why, and my path was forever changed. After that. Yeah.
I can only imagine. And so from there, then it became working on your health, and then now helping others.
Indeed. I mean, it was, people ask me my story quite a bit, my patients, right? They seem to like to know that I've suffered alongside of them.
I know. They all want to know why we suffered. We're like, yes, this is why we're helping you now.
That's exactly right. And they're like, how long did it take you to heal? Right. And I'm like, well, I was in med school when I figured out what was wrong with me. I had my first child around that same time. Like
fatigue on top of fatigue.
My bucket of tolerance my bucket was full at the time. Right.
Right.
So it took me some time, but I was able to, through the book and through talking to Dr. Posnecker and actually coming out and doing kind of preceptorships with him and learning things and his guidance, I was able to kind of stay afloat, right, and gradually work on healing. Ultimately, I did a residency with him for a year or 2 years before he passed away, and then kind of took over his practice. And he had specialized in adrenal fatigue for 30 years prior to me even coming here. And since then, I've been doing it for 20. Really, just kind of my life's work is this effort to help people understand what adrenal fatigue is and try to catch it as early as possible, because it's really a truly deep kind of underlying cause of a lot of what I would consider even secondary or tertiary conditions. Like my Epstein-Barr, or even the anxiety I was having, or the food allergies that I developed, the candida, those kinds of things. And
so different triggers.
Yeah,
they're made an inflammatory response to this, or it could be multiple.
It's always multiple, right? To me, I see us as having, we kind of have, so I'll go this way.
Let's talk about that. Yeah.
Adrenal fatigue is tough because it's very poorly understood out there. Conventional medicine they're not taught that it's a thing.
Yeah. So I feel like on my functional medicine group, even their take on it, they do address it, but the overview is talking about how conventional approach doesn't believe in it. Correct. And I think when you just say nothing, when you put a mask over something and say it doesn't exist, that always kind of concerns me. So it's like, why is that? And explain to us what adrenal fatigue is.
Yeah, sure.
It does exist, obviously.
It does exist.
Or whatever you want to call it. Yes, there is a stress response that is happening.
And that's the problem, right? It's the
come on, let's talk about that.
The naming of it. They're taught that if you don't have Addison's disease, that if your adrenals haven't completely failed, that you don't have an adrenal problem. That's pretty much it.
Right.
They will chase after and acknowledge the symptoms that we associate with adrenal fatigue, which I'll mention. Even if I think about that logically, if we look at the rest of the endocrine system, right, you're allowed to have a thyroid problem that's short of complete failure. Mm-hmm. You're allowed to have a problem with your ovaries or testes short of complete failure. Mm-hmm. Not your adrenals. Like if your adrenals are functioning at all.
But it doesn't make you go, it's still a machine. Like, why is that all of a sudden just like a standoff? All right, it doesn't exist. Just like the appendix. Oh, it doesn't exist. Like I'm just putting out the appendix or the liver. All right, the liver and the pancreas are, why do we have all these? That's a whole other conversation. Talk about it another day.
Understood. Yeah. So it doesn't make sense, right? And it didn't make sense to me. If we go away from conventional medicine, broaden our horizons a little bit, look towards integrative medicine, you'll find doctors that believe in it and test for it and even find it. But at times, it's like they've kind of just grabbed hold of a tail of something that's a little bigger than they anticipate. Because the adrenals, if we think about it, the adrenals are definitely part of the problem because they're producing the cortisol and adrenaline, which I give a bad rap to all the time because of all the damage that causes, right? But it's life-saving. Like we wouldn't be here.
Fight or flight or the needs, right. Yeah.
But the adrenals don't decide whether or not to release those hormones, right? So somebody tells them what to do. So if there's an adrenal problem, there's got to be a problem with whoever yells at the adrenals, right? So, we have to look at the hypothalamus and pituitaries, but this gets us to the hormone side of the stress response system. There's this other side of the stress response system, which is all your nerves, basically your autonomic nervous system, right? Controlling all your organs. Those systems work together. I tease them apart because treatment and symptoms can be a little varied. But neither of those divisions of your stress response system actually call the shots, right? The limbic system just above that hypothalamus, right? That kind of deep central part of our lizard brain, like that's the CEO of your stress response, right? Constantly looking for and assessing our environment for danger, right? Whether that's external environment through senses, perception, internal environment through chemicals in the blood supply. And when it receives that information, it's got to react. Right? Is this stimulus harmful, dangerous? Can this kill me? Do I got to jump this body into fight or flight? Right? Hormones, nerves, or is it the opposite? Is it harmless, innocuous, and I can chill out in vacation mode and just let it pass? Right? Well, what we know is that with a bit of a genetic predisposition and enough chronic stress over time of any kind, that limbic system gets trigger happy. It gets sensitized, right? So that minor stressors don't generate a minor response, right? You've got a minor stress, but it's now a major response. So this limbic system's kind of making mountains out of molehills. Now we're over-interpreting our environment as dangerous, and we start getting stuck physiologically in fight or flight. And to me,
I remember those days.
Yeah, right.
I remember those days.
Sadly,
I do. Unfortunately, I wish I wasn't one of your patients, but I probably should have been.
Yeah, and patients will say that. They're like, well, that's what I feel like. Like I'm always in fight or flight. I'm like, I know, that's the problem, right? But the stress might not even be there anymore. It's just the limbic system is wound really tight.
Yeah.
So the most accurate name, in my opinion, to call adrenal fatigue is actually not a very sexy name, but we would call it a stress response system dysfunction. Because it's all of that, right?
But I mean, well, then you'd have to write a book on it.
I know. Oh my gosh, I was just having this conversation both with my staff and a group of my patients where I do these group calls. They're like, Dr. Neville, share this.
Well, I'm trying to write like a book right now, so I totally know. And then I'm trying to do a collaborative with all the guests. And as we're chatting with this, you can do the book with the stories of all your patients and then your story.
Indeed.
At some point, perhaps someone help you write it.
There, right? It's in the works. Right.
That's another combo.
Yeah. Now, conventional medicine will look at the symptoms that come from being stuck in a stress response, right? Whether it's fatigue or pain or insomnia or weight.
We do. Yeah, that's, I feel like
anxiety,
that's our go-to.
Depression, all that stuff, right? And which I'm not against symptomatic treatment, right? But like, so you go to your doctor and you've got sleep problems or anxiety. Well, take this med for that and this med. And if you're lucky enough to pick the right drug, I mean, you might cover up the symptom, but you haven't fixed the underlying problem, right? And this damage persists over time. Right. So using meds or herbs, right? I mean,
whether either any supplement, anything, right?
Right. If you're just covering up the symptom, you're kind of like putting a little piece of tape over the check engine in your car, that check engine light, and obviously not fixing the problem. And it can get worse over time.
Yeah.
Now that's kind of confusing enough for a lot of us, right? But it's worse than that because when you're stuck in fight or flight, you're suppressing some pretty important stuff, right? Because you're going to activate the organs that'll save your life, right? Your heart, your lungs, your sugar metabolism, right? There's four major organs that we suppress when we're in stress physiology: immune, digestive, reproductive, thyroid. And we know that. That's conventional research, right? We know that. And it makes sense too, right?
Totally makes sense.
You're fighting a tiger. You don't want to
those aren't the priorities.
Waste energy with inflammation or fighting a chronic infection, right? Don't waste energy digesting, absorbing. Don't really want you to have a bowel movement right now. Like there's a tiger. Same thing with your ovarian hormones, right? We don't care about your periods or your sex life, or don't really want you to procreate, right? There's this tiger. What we also know, which I didn't learn about in med school, it was kind of afterwards, was that excess cortisol goes to the hypothalamic pituitary thyroid hormone axis and suppresses it at every level it possibly can.
Oh, I didn't know that either. I knew that it definitely suppresses, but I didn't know at
every level. It's wild the way that works. It even goes so far as to convince the thyroid to release an inactive form of thyroid hormone called reverse T3.
Reverse T3, right.
Just in case it missed blunting the thyroid hormone anywhere else, let's release this inactive form of thyroid hormone, bind up all the receptors so it really doesn't work.
So then nothing's
right. So now, of course, you do that once in a while, it'll save your life, right? Conserve energy here, deal with the threat, turn that stuff back on later. Do it chronically, you're going to have all these immune problems, digestive problems, reproductive hormone problems, thyroid problems. But what's happening on a bigger scale is that you're suppressing the organs that we use for healing and repair. So we've got this kind of physiologic equation over the months and years and decades sometimes of excess wear and tear coupled with suppressed healing and repair. Not a great equation for good health and vitality.
Because your body's just not able to heal.
It won't. Even from a genetic standpoint, right? If we talk about the genetic, like your total genetic switch, epigenetic switch, right? When you're in fight or flight, you're geared up for survival. You don't care about healing or repairing bones or growing hair or like all that stuff is shut off. So the ultimate goal is we've got to shift this physiology, right? Turn off the wear and tear, turn on the healing and repair. So from a naturopathic standpoint, to me, we talk about the healing power of nature, which is good. We can use herbs and vitamins and things like that. That's nature. But to me, turning on this physiology, right, that rest and digest, healing and repair state of physiology is initiating, our body's own healing and repair mechanisms. And that's what heals people. Like I've got all kinds of vitamins I can give people and herbs and things, but supplements, I tell patients that like supplements don't fix you, right? Supplements they're kind of aptly named, right? They're supplemental to a bunch of other stuff.
Right.
To me, the supplements are like, it's like we're going to repair a house, right? And, we got to deliver all the tools and equipment and lumber and get all that stuff to that job site, right? But if nobody tells the crew to show up, nothing happens, right? So that's all the supplements and herbs. To me, we got to tell the crew to show up. We got to turn on the genetic cellular machinery of healing. And that's when we can use all that other stuff that we need to be able to orchestrate healing. I love it. I love being able to shift.
What do you think has been the number or it obviously must have seen patterns.
Mm-hmm.
What are number one patterns or patterns that come up for you with these patients or for yourself?
With regard to why
they have these issues.
No, it's a good one. So again, it's that genetic predisposition and enough stress over time to overwhelm the genetics. In this, I view stress in that we all have just this one stress response system, right? The hormones, the nerves, the limbic system, and the brain. So I picture it like a bucket. We all have a certain size bucket genetically, right? Half from mom, half from dad. Some small, some big. You can overwhelm anybody's bucket if you throw enough at them. But the bucket wasn't designed for the stress we have today, right? It's designed for hardship, like old school stress. Give me a good old fashioned famine or a plague or a predator. Like bucket fills up, jump into fight or flight to deal with it, hopefully. And if we live, the bucket drains, we shift out of fight or flight. So we turn off the wear and tear, turn on the healing and repair, live to fight another day. Most of us don't have stress like that these days, right? No. But we start filling up this bucket left and right, all of it goes into physical, mental, emotional, spiritual, social, diet and nutrition, toxins, accidents, surgeries, injuries, especially head injuries will predispose somebody, but even past trauma, abuse, jobs, relationships, divorces, death, politics, finances, social media, like it all goes into that same bucket. So everybody's bucket is a little different, right? But I picture, there's, heavy metals, right? Mercury would be in there, or candida would be in that bucket, a layer in that bucket. But everything's in there. In addition to all that various stuff, people who develop adrenal fatigue tend to kind of be cut from the same cloth in that we're pretty good at filling up our bucket on our own, right? So we can be a little more caring, a little more sensitive, maybe. We're doers, right? And because we care about what we do, we tend to do things well. And then people ask us to do things because we do things well, and then that feels good. And then we do more things, and now we become a little more.
Oh, but then your bucket keeps getting.
You got it. We're filling up our bucket, right? So
story of our lives.
Indeed, overachieving perfectionist type A. So we're kind of good at filling up our bucket. Not that it's.
So you're saying that there's a lot of individuals that are in this category of chronic fatigue, adrenal to chronic, that have this, these other ancillary things, but addition also have a similar behavior.
Absolutely.
Yeah. Wow. That's a whole other way of talking. I wasn't even going into the psychological behavioral part, because just seeing like patients, right, or clients that I'll see, I'll have them kind of give me an idea. Like I'll try to find out their behavior, or their learning style. And it's interesting that you say that specifically, or majority of the patients you're saying, or clients that you see, have a very similar pattern or similar personality.
They do.
Personality or behavior.
It's behavior. It's behavior. A little bit of personality too, but behaviors. And
that's interesting.
They might have served us in the past, right? But they can get us in trouble in times, right? So part of what we have to do is, pay at least a little bit of attention to that. I was just having a conversation with some coaches that I'm training for this, and we were talking about how people who develop adrenal fatigue tend to be a little more sensitive than the average person.
I would call that, is that like empathic sensitive, or just sensitive in general?
In general, but including empathic. There's this question, right? Well, is it that the adrenal fatigue causes the sensitivity, or are just sensitive people more prone to adrenal fatigue? And my answer to that is,
that's so interesting.
Both are true.
It's like a chicken egg
thing. Both are true, yeah. Because when we know that with stress over time, when we keep hitting this limbic system with stress hormone, it becomes trigger happy. It becomes sensitized. And in the research, they call that central sensitization for the central nervous system, where now the limbic system is, those minor stressors aren't generating a measured response. They're generating a heightened response. Well, that sensitization actually happens throughout the nervous system, including even the sensory nerves. So by the time patients come into me, and it's been long enough, a lot of them are, they're like, I'm sensitive to these bright lights, doc, and loud sounds bother me, and harsh chemicals and smells, even touch. You touch one of my patients and their limbic system registers it as pain, which to a large degree is fibromyalgia, right? Because, what is fibromyalgia? Like, it's a name, right? 4 pounds of pressure and 11 out of 18 tender points. I don't know. That doesn't mean anything to me. I want to know about why on earth would that happen? Why can I just touch somebody and they feel pain? This sensitization is part of that. So we become sensitive on so many levels. As a matter of fact,
it makes sense. The energetic pathways are just like probably on fire.
Absolutely. We just tend to over perceive everything, right? Which is tough because, and the limbic system's trying to protect us, right? From, but it's not very evolved, right? It still thinks we're living in the plains of Africa, being stalked by a lion, right? Where if you were hypervigilant, like that would save your life. Like you want your pupils to dilate, your ears to be hyperacoustic. The faster you detect the lion, the better your chance of survival. We don't live that way anymore. We live in today's world, which is loud and toxic and fast-paced and obnoxious a lot of times, right? So we bombard this sensitized system, left and right. So it's tough. It's tough. We've got to create some space in people's bucket. And, we want to hit that. I mean, the only way that I've figured out how to do this is kind of try to determine what everybody's therapeutic puzzle looks like from this perspective, because they're all different, right? We're all a little different. I mean, the physiology is the same, so there's some commonality, but figure out what that therapeutic puzzle looks like, again, in the direction of fixing this underlying problem, not necessarily chasing after symptoms, not even necessarily chasing after these secondary or tertiary dysfunctions, because it a lot of times trying to fix these problems, right? The immune, the gut, the hormones, all that stuff, trying to fix those problems while your body is still purposely suppressing them. It's kind of like trying to push a car that has a parking brake still engaged, right? Like kind of release that brake, and then those systems can turn on their own, right? Let's turn on the vagus nerve, right? And then maybe the gut has a chance to work, right? Stuff like that.
It makes a lot of sense as how you're placing it. I mean, and from my work, from just this, I call it stress transformation, I didn't even think of where you're going with the other parts are not even coming on, So it's another avenue that I'm even going to look in perspective, because I just did it out of necessity to learn for my own. And I don't even think I even went to the right people to teach me initially, or to learn, to get the right answers. So yeah, I think it's quite interesting.
It's funny. And we were, so we're talking about a book, right? Like I need to be able to write this book, because the information and the research is all out there.
Oh, so just video it. Like what's it called? I speak it on a and have someone transcribe it. A computer transcribe it.
I should do that. I'm gonna.
That's what I do.
Again, I'll get some tips from you on how to make this happen, because the information is all there. It's just in so many disparate places. Like you can talk about to the neurologists or the psychiatrists, right, or the neuroscientists or the cardiologists. I mean, the research on stress and digestive problems, cardiovascular problems, immune system problems, all that stuff, even the central sensitization, the dysautonomia, the adrenals, basically just the need is there, right, to tie this stuff together. And then, what does that look like? So instead of continuing to chase after all these symptoms, I mean, even depression, right, which is like the number one reason for disability these days. I mean, if you put a rat in a model of what they call chronic unpredictable mild stress, this CUMS model, they call it chronic unpredictable mild stress, that rat develops depression. Pretty sure that's not a psychological problem, right? When you hit the brain with a bunch of stress hormone, it's very predictable what happens, right? We see depression, anxiety, we see insomnia, we see brain fog.
And and there's originally, and then they're like, oh, that's a pill. And you're like, I mean, why are we not looking at the inflammatory response and the stress response that's coming out of that? It's like, I don't know what it is. I don't know. That's why I'm like, I love meeting individuals like yourself and individuals that are talking about this different perspective, because it needs to be like a normal conversation. Like, so mental health providers that are on, or those that are listening, like, yes, maybe you have severe XYZ, but there's most of the time there's something else in life.
Well, there can be, absolutely. And it's not that we shouldn't we shouldn't have therapy and meds. Like, some of that stuff is necessary.
Of course.
It's just thinking of them, too narrow-minded, right? Like, none of this stuff exists in a vacuum, right? Everything's connected. It just takes a lot of time, basically, to have these conversations with patients and to work on these things. And, conventional medicine, unfortunately, they're not set up to be able to kind of provide that time. And that all goes into the psychiatric kind of realm, right? Like, oh, that's therapy. Like, I only get 10, 15 minutes with my patient. Like, it's hard to have these conversations, unfortunately, stuck in that model. They're stuck in it's a tough model for sure.
Yeah, that's why I kind of changed my whole practice model.
Yeah.
Couldn't handle it anymore. I was like, I have to do something different.
Yeah. Agreed. I mean, I didn't grow up as a kid even thinking I wanted to be a doctor, right? I had problems and nobody could really find answers. And I can be a little persistent, right? That rhino, maybe a little focused, right? And, that takes me all the way to med school. Conventional medicine had already kind of not really worked for me.
Right.
They weren't kind of finding underlying problems. Like I had high blood pressure when I was 25 years old.
You're like, what?
Just
Yeah.
take the blood pressure medication. I'm like, okay, but why do I have high blood pressure? I'm supposed to be in the prime of my life. I'm 25 years old, and like, no, just take the med. And I didn't really tolerate the meds. So it was kind of easy for me to kind of say, all right, I gotta figure something else out. And, naturopathic medicine just made sense because I could get all that education that I needed. I mean, all my patients are medicated, so I need all that pharmacology. I need to know all that stuff to be able to handle that. Right. But then learn how to heal people and how to really shift this physiology. So, I love
Makes
it.
sense.
I'm passionate about it.
That's great. I love it. I'm so glad for you to be on the show. How can those reach you? At first, do you have like one quick, you've given so much knowledge today, but do you have another one quick tip that you'd like to leave?
Yeah. So over the past, I don't know, 10 years or so, as far as my kind of evolution in thinking about this stuff, one of the things I'm most excited about is this concept of neuroplasticity, right? And
Fascinating.
the research, it's phenomenal and so exciting to me, right? To be able to change the brain, to be able to rewire the brain, to be able to stimulate stem cells and nerve growth factors, whether that's with, and there's a variety of tools that can do that. Certainly there's a few supplements and herbs, but also relaxation exercise and meditation. But if I had to boil down all that neuroplasticity research that I've looked at in books and things, it kind of boiled down to this one thing of being present, right? Being intensely present in each moment, right? This concept of mindfulness, which is so incredibly difficult. I was driving. So my son, I had to bring him to work today and he was late, of course. And I'm trying to teach him a lesson, so I'm not going to wake him up. So this now makes me late, right? So I'm
Right,
45
because you're
minutes late.
trying to get through the day and try to do your one. Yeah,
Exactly. This is the one thing I had to do. And now I've got this. So now it messes up my whole day. I'm driving back to the clinic in my Jeep. And this is what I'm thinking about. He screwed up my whole day, blah, 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 blah. I'm like, okay, doc, focus. Like, get at it. You're not fixing anything there. Just be present, right? You're in your nice old Jeep that you like. The top's down. The sun is beating on your head, and just be, right? Just be. So it's these reminders that we all need, right?
It's definitely. And then also his suffering is not your suffering. So just keep changing the pattern, right? You have to help change his pattern, right?
That's exactly right.
You know what I mean? It's like I had to forcefully learn being present because I wasn't present.
Yeah.
And I was to the point of probably rock bottom. So my obsession with mindfulness is because of necessity.
Yeah.
Now it's just the way I live, and that's why I talk about it every day.
Yeah, as do I. So I agree.
Yeah, you do, right?
So to me,
now
that's one of the biggest things. Yeah.
And it just becomes something where it's like, okay, he doesn't know yet, so you got to teach him.
Oh yeah. Absolutely.
But he may not listen right away. That's all.
Well, he's a teenager, right? So they kind of know everything at that point.
But I think I appreciate you saying that, being present, because and knowing that we can come back to it when you're not.
Indeed.
Because it's an evolving thing. It doesn't just happen every day, every second.
It's a hard thing, right? And I'm, I've been doing this for a long time, right? But I still will catch myself. It's better at it, right? But it's
all the time.
It takes work, right? It does take work.
It totally does.
Yeah.
It's a daily. It's a every day.
Indeed, it's a habit.
So it was such a pleasure having you on the show. And first, I know I'm going to have in the show notes your information, but how can they reach you?
DrAndrewNeville.com. You can reach out and talk to, I even have my care team, my consultants. They offer kind of free calls to talk to people about some of this stuff, to see if there's if a match. But I've got I've got a YouTube channel and Instagram and like tons of videos about this stuff as well. So by all means, reach out.
That's great. And I thank you so much for being on the show.
Thank you. I appreciate it. It was a pleasure talking to you.
And thank you guys for listening in to the Mindfully Integrative Show, and make sure you find a mindful way each and every day.
Thank you for listening to the Mindfully Integrative Show with Dr. Damaris Maria Grossman, family nurse practitioner. This podcast is for informational and educational purposes only and is not the substitute for professional medical advice, diagnose, or treat. Always consult your healthcare provider before making changes to your healthcare routine. Make sure to subscribe so you don't miss an episode. If you enjoyed our show, please support us by leaving a mindful review on Apple Podcasts or your favorite streaming platform. Interested in being a guest or more information? Email us at info@mindfullyintegrative.com. For resources mentioned in the show, visit our website at www.mindfullyintegrative.com. You can also connect mindfully with Dr. Damaris on her social media links found on the site. May your strength and peace guide you to find a mindful way every day. Namaste.